the Alberta Association on Gerontology Living Well, Enhancing Seniors Care and Services Speakers Series. Today's session on Living Well at End of Life is our last one. I am Lynne Mansell. I'm a board member of AAG and your host. Just a few things to start off with. We're using Zoom webinar, so everyone is muted and you will not be seen on camera. And with the approval of our speakers, we will be recording the sessions that you'll receive a link to, but your names and your private information will not be shared. If you are having any difficulties, you can type a chat in the chat box and we'll do our best to respond. But please type your questions to the speakers in the Q&A box. The speakers will share the presentation for about 20 minutes, and then when they finished, we'll address as many questions as possible by the end of the 30-minute session. So I'd now like to turn the session over to our guest speakers who will introduce themselves, starting with Michelle.
Great, thanks, Lynne, and thanks for the opportunity to present to the group today. So I'm Michelle Peterson-Fraser. I'm the Provincial Director of Palliative and End-of-Life Care with Seniors Health and Continuing Care with Alberta Health Services. Emma?
Hi everyone, I'm Emma Buzat. I'm one of the leads with Michelle's team with the Provincial Palliative and End-of-Life Care team.
And I am Jim Sylvius. I'm the Senior Medical Director for Provincial Seniors Health and Continuing Care, and I have palliative and end-of-life care within my portfolio.
Hi everyone, I'm Beth Wilkey, and I'm a registered nurse and certified with palliative end-of-life care and gerontology, and great to see you all. Thank you.
Great, so I'm going to get us started and ask Emma if you can just advance the slide, please. So this is just our standard copyright slide for Provincial Seniors Health and Continuing Care for our presentations. Next slide, please. So in 2014, the Palliative and End-of-Life Care Framework document was published along with a companion document specifically for patients and families. And the overall goal of the framework is for Albertans to have equitable and timely access to high quality interdisciplinary palliative and end-of-life care services, regardless of the life-limiting illness or geography. The framework provides a standardized approach and directs the development of integrated and accessible care for the dying in our province. There were 36 initiatives recommended from the framework, and to date we have completed 21 of the 36 initiatives provincially. Next slide. So as part of the framework development, the steering committee needed to agree on definitions for palliative and end-of-life care. And I won't read the definitions, but want to stress that palliative and end-of-life care is a continuum of care from the time of diagnosis of a life-limiting illness through to the time of death and into bereavement. It demonstrates that a palliative approach to care can occur simultaneously with the curative approach or during treatment. The model of care here is adapted from the Canadian Hospice Palliative Care Association and is a guide to the conceptualization of our work. So these definitions have actually been revisited by the Provincial Palliative and End-of-Life Innovation Steering Committee, which I'll tell you about in a minute. They chose to keep these two definitions of palliative care and end-of-life care. However, the committee did choose to amend the definition of the palliative approach to care. And so I will actually read that because I do think it's applicable to the audience today. So the palliative approach to care focuses on the person and family and their quality of life throughout the illness trajectory, in advance of and not just at the end of life. And again, a palliative approach to care can occur simultaneously with disease-directed treatment. This includes supporting and managing illness, comprehension and coping, symptoms and functional status, advanced care planning and the patient's preferred method of decision-making, coordination of care, and support for families and caregivers. And this revised definition is adapted from the Canadian Hospice Palliative Care Association, PIERA, and the Cancer Care Alberta. Next slide, please. So this is the Provincial Palliative and End-of-Life Innovation Steering Committee. It is an advisory committee that oversees the development and implementation of the best performing publicly funded palliative and end-of-life program in Canada under the guidance of the plan within the Palliative and End-of-Life Care Provincial Framework. Of note, Dr. James Silvius and Barbara O'Neill are the co-chairs of this committee. The membership on this committee is all the people that you see on the slide deck, but I would just like to point out a few key groups: patients and families, Indigenous health representation, Alberta Health sits on this committee, as well as the Covenant Health Palliative Institute. Each year, this committee prioritizes the work to be done in the next fiscal year, including any outstanding framework initiatives that need to be completed. Next slide, please. Alberta has actually been recognized nationally as a leader in providing an integrated and innovative range of palliative and end-of-life care programs and services. But even though we are leaders in palliative and end-of-life care, there are many Albertans and healthcare providers who do not know about what's available and how to access it. And despite the fact that we have completed 21 out of the 36 initiatives from the framework, the steering committee identified a need to commission a health technology assessment to help achieve this above directional policy recommendation that is on the screen. This health technology assessment was completed by University of Alberta, University of Calgary, Alberta Health, and an expert advisory committee made up of individuals from within the steering committee and external people that were interested. This health technology assessment was completed to inform quality palliative and end-of-life care programs, irrespective of where people live, while recognizing differences in geography. The directional policy recommendation in the palliative chapter of the report, which can be seen on this slide, is very definitely congruent with the vision of the Provincial Palliative and End-of-Life Innovation Steering Committee. Now I am just going to turn it over to Emma.
Thanks, Michelle. So in order to achieve the directional policy statement that Michelle just spoke to and that is outlined in this chapter, 5 immediate actions were recommended to inform work in 2021-2022. The first palliative recommendation outlined in the report is to improve the quality of end-of-life experiences for seniors, family, and staff. The following slides will address each one of these bullets in more detail. The first sub-recommendation in the report aims to reduce the severity of burdensome symptoms by increasing staff awareness and referrals to specialized consultation services. In Alberta, 24/7 access to on-call palliative specialists are available across the province, but not all providers and programs refer to them. In addition, the primary care provider has the option to accept or reject the recommendations of the specialist. Increased awareness and education are required on burdensome symptoms and the benefits of palliative consultation to reduce intractable symptoms. The second sub-recommendation aims to enhance access to technology through funding for devices and adequate internet access across the continuum and province. In response to the pandemic, there have been great strides in virtual consultation to palliative physicians, home care, and interdisciplinary team members using Skype, Zoom, telephone consultations, and other platforms. This blend of services has increased contact with patients, families, and providers. In addition to access to virtual grief and bereavement services, there's an online directory of grief and bereavement resources that are available on the provincial palliative and end-of-life care website. As a response to COVID-19, AHS has also created various operational guides on topics such as video technology for virtual healthcare in congregate settings. The third sub-recommendation aims to increase access to staff resources at end of life in congregate settings as needed. To help address ongoing staffing shortages in Alberta continuing care sites due to the COVID-19 pandemic, AHS is working with Manpower Staffing Services to recruit a temporary pool of comfort care aides. Comfort care aides are being deployed to designated supported living and long-term care sites regardless of outbreak status. The continuing care aides will be able to assist with a range of duties, including assisting healthcare providers with end-of-life care. Throughout the pandemic, the provincial palliative and end-of-life care team and zone operational teams have been strong advocates for volunteers to continue to be able to work in these settings of care. In addition to the 24/7 palliative on-call physician service, programs like the EMS Palliative and End-of-Life Care Assess, Treat, Refer are available in home, supportive living, and long-term care settings to help manage patients' pain and symptoms. This is a non-lights and sirens response where paramedics can assist the healthcare professionals to manage symptoms with additional medications, as well as collaborate on the phone with palliative physicians on call or an online medical consultant physician. The goal is to manage the patient's symptoms in order to stay in their current setting of care and avoid admission to the emergency department if that's the patient's wish. Unfortunately, many people are not aware that resources like this are available across the province. There's a need to increase awareness and communications about services like Assess, Treat, Refer to healthcare professionals, as well as patients and their families. The Provincial Palliative and End-of-Life website is a great tool to find information on programs such as the EMS Assess, Treat, Refer program. The website is a centralized access point that can help patients, families, and healthcare providers navigate what resources are available to them. Parallel to our provincial palliative and end-of-life care website, there's also a provincial website for advanced care planning. This website is also for patients, families, and healthcare providers. On the AHS app, there's also a quick reference for resources on advanced care planning that can be downloaded on any mobile device. Both the provincial and advanced care planning web pages have inboxes which are monitored by the provincial team. Advanced care planning and goals of care designation is a provincial policy and procedure that is required in all settings of care across Alberta. This program replaced the code-no-code dichotomy that existed in the past and intended to allow patients to identify their preferences in care, including resuscitation, if they should be in a position where they can no longer speak for themselves. The Provincial Advanced Care Planning Goals of Care Designation Community of Practice meets quarterly to continue to champion increased awareness of and work supporting advanced care planning and goals of care designation across the province. In addition, the government has recently funded a project with Covenants Health Palliative Institute and the Office of the Public Guardian to increase public awareness of advanced care planning. The third sub-recommendation outlined in this report aims to increase the proportion of deaths at home or hospice and reduce unnecessary transfers to acute care by increasing community-based service capacity. One of the Enhancing Care in the Community programs that has recently been implemented is the Rural Palliative Care in-Home Funding Program. This program will help enable clients with palliative conditions who live in rural and remote areas to be supported to stay at home when desired and when they require care beyond existing services. Funding from Enhancing Care in the Community supported the creation of a formalized palliative program in North Zone. This made a significant impact on acute care utilization by supporting patients dying in their own home and community. COVID-19 has significantly increased the proportion of people whose preference is to die at home. We're looking at how to sustain this with the appropriate supports. In addition, as referenced in section 7.1, other programs like EMS, palliative and end-of-life care, assess, treat, refer also support enhancing care in the community. Finally, Alberta Health and AHS have prioritized a redesign and evolution of home care to improve quality, access, and increase capacity. The fourth palliative recommendation outlined in the report aims to develop and implement standardized competency-based staff and student education for all care providers using easily accessible technology. Since the development and publication of this report, the Covenant Health Palliative Institute, under the auspices of the Provincial Palliative and End-of-Life Innovation Steering Committee, has published interdisciplinary palliative and end-of-life care competencies. Looking forward, we need to identify what is in place now and how current education meets the competencies, as well as how to address any identified gaps. Finally, the fifth recommendation in the report aims to increase the engagement of primary healthcare providers. As Connect Care goes live in different areas across the province, this will create the opportunity to have stronger linkages between primary healthcare providers and continuing care programs. Connect Care will enhance a person-centered approach as patients and families can upload advanced care planning documents, such as their personal directives, into the patient portal. Patients and families will also be able to ask their family physician questions online. The Provincial Palliative and End-of-Life Innovation Steering Committee and the Health Technology Assessment Report recognized and has prioritized the need to develop direct links with primary care networks and family care clinics to support the provision of palliative and end-of-life care in local communities. More work is needed to address this in the future, as this is still a gap across Canada. As Michelle mentioned at the beginning of this presentation, the directional policy recommendation in the palliative chapter of this report is to strengthen and fully implement a comprehensive and integrated range of palliative and end-of-life care services across the province to ensure that Albertans experience optimal quality of life at the end of life, wherever they wish to be. The addendum to the framework, which is yet to be published, acts as a provincial roadmap to support this policy recommendation. The addendum describes the initiatives that have been completed to date, a current state analysis, and outlines the plan moving forward to address any outstanding gaps, challenges, and the work ahead as prioritized by the Provincial Steering Committee. In addition, another activity that will influence palliative and end-of-life care services across the province is the palliative review that Alberta Health is currently conducting. Alberta Health has assigned MLA Dan Williams to conduct a review of palliative and end-of-life care across Alberta. Once the engagement process is complete, a report with recommendations to support and enhance palliative and end-of-life care in Alberta will be submitted to the Minister of Health. This will inform the work that needs to be done ahead to continue to improve quality access to palliative and end-of-life care across the province. I'd like to thank everyone for their time for attending today, and I'm going to pass things back over to Lynne to moderate the question period.
Okay, thank you for a very comprehensive presentation. So please type your questions into the Q&A box. Maybe while we're waiting for others to do that, I was just wondering, with all the concern in the community about other things, such as the effects of the pandemic, I'm wondering if the advanced care planning is at the level, the percentage of people with personal directives and wills, has that increased or decreased? Do you have a sense for that? And what do you think can be done?
Well, I can just start off by saying that the green sleeves the supply of green sleeves going out over the last year and a half has dramatically increased.
Mhm.
The public is really asking for them, and so I do know that they are in demand for sure. We also have, as Emma alluded to, a lot of questions that come in through the Conversations Matter inbox from both the public as well as healthcare providers. And we are able to redirect to the Office of the Public Guardian to give contact information for help with personal directives. I don't know if anyone else wanted to add to that.
Yeah, just to add to Michelle's response, we've also seen a significant increase in the number of people visiting our provincial advanced care planning website as well, especially at the beginning of the pandemic.
Good to know. Okay, I have a question here. I think it's for Jim. How does the new MAID policy impact the work of the palliative end-of-life care service?
So just to be clear, it's new MAID legislation at a federal level within the Department of Justice. And the short answer is that it doesn't. The MAID service is a separate service. It's an additional end-of-life care option. It's separate from the palliative and end-of-life care service, and the two operate pretty much in parallel. There are interactions between them that vary in extent across different parts of the province, but they often coexist with each other, and we're not anticipating that we're going to see any particular change.
Thank you. There's a question I think that maybe Beth could take about moving home from acute care. When a patient is, in quotes, sent home to die, who initiates the support at home? I know of someone whose mother was sent home and never got any support, and she died on February 4th.
Oh my, that sounds terrible. I'm very sorry to hear that. The process would generally be, and anyone else, any of the other panelists jump in, that referral would be made generally by the person's primary physician to home care. And specifically that would go to palliative home care, and they would start the process for an assessment at that point. And once the assessment occurs, then that palliative case manager would meet with the patient and family and go from there in terms of services provided.
Yeah, and thanks, Beth. If you don't mind, just add to that. In the provincial palliative and end-of-life care website, there's a finding service tab that you can click on, and it'll say how to access palliative and end-of-life care programs and services by zone. In addition to that, patients can refer themselves to home care, but referrals to palliative home care are generally made by clinicians.
Okay, thank you. Back to the green sleeves. Where do you get the green sleeves? Anybody?
Emma, I'll start off. Okay, so if you go to the Conversations Matter website and you click on the resources, there is a very detailed explanation on how to order the green sleeves. And now, Emma, correct me if I'm wrong, but I believe that 2 green sleeves are free to the public. You just have to order them. And then the healthcare providers and primary care physicians would go on to data group, but it's the same instructions actually that are on that website. Anything to add to that, Emma?
Along with that instructions, there's also our Conversations Matter email, so that if people have additional questions or having issues navigating the process, our team can support with that. Good,
thank you. Another question. the person says, I recently saw a story in the newspaper about an initiative in the city of Airdrie that involved the use of psychedelics in end-of-life situations. Is this something that is being investigated by provincial and palliative end-of-life care?
Maybe I'll start. The short answer is no. I am not aware of any particular initiative, and I didn't see the story, so I can't comment further, but I suspect the other panelists will have the same amount of information about this that I do, which is none.
I'm sorry, I haven't heard of it, but I can definitely follow up.
Thank you. I think those are all the questions. So you said
No, there's another one, Lynn.
there is. You're right. Thank you. The question says for home care. Oh, I guess they're talking about palliative services is not needed. Clinician referral only. Client family could do a referral as well. Yeah.
Yeah, for general home care, that's exactly correct. But typically for palliative home care, it is a clinician referral. Beth, do you want to comment?
That's right. Anybody can phone in either to, I believe you can phone HealthLink, but there's also a community care access number that someone can phone into and self-refer or refer a family member or even anybody that is felt needed. But specific to those palliative services, that's something that gets determined between the patient, family, and the clinician, and that referral is made from there.
Okay, we actually have a few questions in the chat as well, so I'll just read them out instead of asking you to retype them. Is there an initiative to have palliative focused nurse practitioners embedded into long-term care sites?
Short answer is not specifically. Longer answer is that there is access, though, to palliative services in long-term care sites, such as the ATR, for example. For if there's a crisis, the 24/7 consultation line is available. I don't know, to be honest, the extent to which palliative consultation is available into the care centers. I know it is in some places. I'm not sure that's universal, but maybe one of the other panelists can amplify that.
I know
that. Oh, go ahead.
I do know that in Calgary zone, there is palliative consult teams that are available to long-term care. And maybe Beth, you could add to that.
That's great. Yeah, it's same. I can speak to the Edmonton zone, and certainly there are nurse practitioners that do provide service to the continuing care centers, and some of them do have a palliative scope.
Okay, just a quick comment here in acute care, and this is at Grey Nuns. Pretty much every patient we discharge from our geriatric services has goals of care completed and provided for them to take home. Another comment, there was a story on CBC about the psychedelics. I think it's very much in an experimental phase. So there's another question here. How long would it take to get palliative services in the home after release from an emergency visit to the hospital? Anybody know?
I was just going to say that in my experience, within the hospitals, there is what we call transition services department. And so those people, as well as the palliative consult team within acute care, would work together to put services within the home. And I would expect that it would depend on the complexity of what would be required within the home as to how quickly that could happen. Although I do know that with COVID, we have made great strides actually in advancing discharge home a lot quicker with some expedited documents that have helped with getting people home quicker.
Yeah, thank you. And maybe this is for Jim, because I know of your interest in dementia care. Are there any resources on palliative care specific for older adults with dementia and their caregivers?
Actually, probably Michelle or Emma's
Okay.
better in a position to answer that.
Yeah, so on our provincial palliative and end of life care website, we have tabs that are specific to different conditions or situations that would impact the types of supports required. So you can find information about that on the provincial palliative website.
Yeah, and there are, as we know from previous presentations on dementia care for this series, there's a lot of interest in this, and there are resources out there from the dementia associations, among other places. Another question, I'm going to rephrase a bit. If a person wanted maid services, how do they request that?
So an individual, and of course the legislation was just passed yesterday, so we are still putting some of our processes in place. We had done a fair amount of prep for this, but it's not yet completely revised everywhere. But it starts with completing a record of request, and that's available through the Alberta Health website. It's also available through the AHS website. If you go to MAID on the AHS website, you get a link to the record of request. The record of request is actually outdated as of yesterday's legislation, but it still is the entry point in. The other option is, and then you can send that in, fax it in, or whatever. There's instructions to do that. The other option is to simply talk with a healthcare practitioner about what the options might be and whether or not this is something that would be appropriate for an individual. So there's a number of different routes in.
Okay, thank you. Well, we've come to the end of our time. Thank you very much to our panel. You did a great job of presenting a lot of information and answering lots of questions. We really appreciate that. We're ending on a high note, I think. I just wanted to let the attendees know that in addition to the link for the YouTube presentation that you can use after this session, and a lot of people have, many more than usually attend it live, so we're really pleased about that. You'll get that link and an evaluation survey via an email to everyone who registered. So please fill out the evaluation so we can think about doing this again. And thank you, everybody. Bye-bye.
Thank you.
Okay, I think, Jennifer, would you please end the webinar?